Good morning, Facebook friends. Helen Archontou here, CEO of the YWCA of Northern New Jersey. So happy to have some time with you on this Thursday morning. For those of you that are YWTV regulars, you know that on Thursdays we share the mic now with Black women in our community to elevate their voices and their stories. And I'm so proud and honored today to have with us Roslyn Collins, who is just a tremendous community servant that we are so lucky to have here in New Jersey. And welcome, Roslyn. Thank you for taking the time to join us today. I know how busy you are.
Thank you so much, and thank you for inviting me. This is exciting.
Well, this is always a important conversation and a highlight of my week for sure. But, in particular, I'm so looking forward to speaking with you today because of the important work that you do, and especially how it's so important, even more so at this time. And there's so much in New Jersey that we're trying to also put in motion policy-wise around the work that you're doing as well. So there's a lot to jump into and talk about for sure. But before we do that, I want to tell our viewers a little bit about you in case they don't know. Roslyn is the president and CEO of Planned Parenthood of Metropolitan, New Jersey, which is located in Newark. In this role, she has oversight of 5 health centers in Essex and Passaic counties, including downtown Newark, East Orange, Paterson, Ironbound, Newark, and Montclair. These centers provide reproductive health care services to more than 21,000 men, women, and adolescents annually through the Family Life Institute. Planned Parenthood Metropolitan New Jersey's education program presents workshops to almost 9,000 individuals. She is a strong advocate for reproductive justice and equity and the provision of quality health care. She has had a very distinguished and progressive career that spans more than 40 years. She's passionate about the needs of families. Her dedication to health options for women and specifically for low-income women in particular stems from the fact that in many instances, Planned Parenthood centers may be the only provider that these individuals are able to see. She earned her bachelor's degree in social work from Seton Hall University and her master's degree in health administration from New Jersey City University. And during her career, she was part of the YW family as well. She held positions at the YWCA of Hudson County, in addition to roles elsewhere at Horizons Family Planning Clinic in New Jersey, Passaic County Committee for Planned Parenthood and Planned Parenthood of Metropolitan New Jersey. As we said, where she has also served as president and CEO since 2010. And she's also been a teacher and a professor. So we're going to talk a little bit about all of that with Roslyn today. So Roslyn, wow, that's a lot, an impressive background for sure. That brings us to today. How does it feel to kind of look back on a 40-year span of work? What does that feel like for you as a woman, as a professional?
Whenever I hear that number, 40 years, it takes me back, and sometimes it feels like yesterday, and sometimes it feels like every bit of the 40-year journey. My introduction to Planned Parenthood came when I was actually 16 years old. I had an opportunity to work in a summer program. And during that summer program, I often say that program saved my life and it helped to shape my journey. And although I did not know it at the time, those two things were happening at the same time. I grew up in the inner city, Jersey City, attending public schools. I had friends who were experimenting with sex and getting pregnant. And to be perfectly honest, I was too afraid. I knew that if I was sexually active, my dad would kill me. And my mom's sex talk was to keep your panties up and your skirt down. That was the conversation that we had around sexuality and sex education. And coming to Planned Parenthood to work at that time, I didn't know what the organization was, what it provided. But I realized that it was an opportunity for young women and women to get the information that they needed so that they were able to make healthy choices and decisions for themselves. And quite frankly, I fell in love with the work.
Mm. Well, I was going to say, from everyone I know who knows you well, the fact that you love your work shows every day in every way in how you lead your organization and how you work in the community. And the fact that you have stayed with it, for 40 years is just, a piece of it. But, many people stay in a career for 40 years and don't still have the energy and the vitality that you still bring to the work. So that's very impressive and
Mhm.
says a lot.
The organization has changed and evolved over the years. My roles have changed and evolved over the years. I often say I've done everything short of actually examining patients, although there were times when I was assisting the physician and
Mhm.
in the room. But the organization certainly, the mission and the values around the organization have remained the same, but we are constantly looking at how we can serve our communities, um, making certain that the services that we offer are reflective of the needs in our community.
So let's spend a minute talking about that. I can appreciate that the organization has shifted and changed with the times, and of course, having a progressive leader, and a team, that is willing to do that and have that flexibility is key in being able to, meet those that we serve where they're at this moment, for sure. But what are some of the changes that you've seen in this work, over your career, and what do you think are the most pressing issues about it for today?
Well, our affiliate, like affiliates around the country, we certainly provide well women's visits. We have male services that we're able to provide. We have contraception available to women. We provide STI testing and treatment, HIV testing. We also, more recently, probably within the last 10 years, our affiliate is now offering medication abortion services. That was new for us about 10 years ago. And more recently, in the last 2 years, we've started to provide telehealth services. And just before COVID, we rolled out the telehealth services, and it became an essential part of our offerings during the COVID vaccine, and the COVID pandemic, and we continue to offer those services. And we are really, really proud. Just in October of last year, we started gender affirming care services for the transgender community, and that has become a very, very popular program. We are providing it currently in our Patterson Health Center, although we have plans to roll it out into the one of our Essex County centers before the end of the year. So, as the needs of the community evolve, as we are able to look to make sure that there is access to healthcare and access to services. We're able to seek funding and roll out services to support the needs.
So let's talk about access, because that's one of the when we look at issues connected to systemic racism, for sure access to services is definitely a barrier, for so many,
Mhm,
in our country, and right here in New Jersey.
mhm,
Can you share a little bit about what we know about access to services and how we can support um,
mhm.
getting that
Certainly,
addressed?
certainly, one of the health disparity is certainly a really, really important concern. And at Planned Parenthood, we try to address that in any number of ways. We like to say that no one is ever refuse services based on their inability to pay. We have a sliding fee scale because we are federally funded and we get state funds. We're able to subsidize care. So a person coming into our health center would be able to get services based on their income, and we really work hard not to refuse to serve people. Back when the Affordable Care Act was introduced and insurance was made available, we hired certified application counselors so that our patients who were uninsured, those who were eligible, we had staff members available to actually enroll them into health insurance. And not only were they able to access that insurance for the services that we provide, but they were also able to enroll their family members into health insurance and get other kinds of services that they might need that many of them had not had access to previously. So we are really, really pleased that when we look at providing services to the community, it's not just necessarily the services that are confined to outdoors, but we really try to have a broader reach.
For sure. And I know that obviously the impact of COVID, for all of us, really shifted and changed our business models, in some ways. But also for you in particular, being, the type of work you're doing actually changed the services you're providing because you now had to add, this to the options. Can you talk a little bit about that and the impact of this time and what you're seeing now in terms of going forward?
Certainly, COVID forced us to look at some of the policies that we had in place. We put a rapid response team together and we were able to determine what we needed to have in place in order to continue to serve the community. We were deemed an essential service and we provided services every single day during the COVID pandemic. We have an incredible team and they came in, they did what needed to be done. We had 2 health centers that we temporarily closed because those centers were small and did not allow for social distancing. So those 2 centers were closed for approximately 3 months. And once we were able to put systems in place, we were able to reopen those centers. And today we continue we have PPE and we are making certain that our patients are safe, our staff is safe, but that we are here to serve the community and we are successful in doing that.
And how are you communicating? I know that getting vaccines done, and increasing the numbers here in New Jersey are key. I mean, we're all thrilled to be seeing the state open up now,
Mhm.
and the numbers are definitely trending in a much more favorable place. But we know that we need to get our vaccination numbers up.
We are exploring we're not providing the vaccine ourselves, but we are exploring partnerships with the municipalities that we are in. Currently, we're in conversations with the city of Newark to come in and set up a mobile unit outside of our health center. And that way our patients, our staff who've not been vaccinated, and other members in the community would be able to have access to that service while they're visiting our health center or within the community. We also will be having those same conversations with the other cities where we have health centers.
Well, that's wonderful to hear, and I think that's when we hear the um, accessibility issues to the vaccine and some of the trepidation that some are experiencing, having a trusted community center like yours as being a place to come and talk over those issues and
Mhm.
the vaccine definitely will, I'm sure, assure,
Mm-hmm.
better confidence and, help across New Jersey with the numbers
Mm-hmm.
increase.
Mm-hmm. And that's a very significant point that you raise because there is a lot of concern in our communities, particularly, and based on historical
Mm.
incidents that have happened around healthcare. When you think about the Tuskegee experiment, where men who had syphilis were not treated, but allowed to die, become blind, infect others. There was in gynecology, enslaved Black women were experimented on to figure out ways to engage gynecology without the benefit of anesthesia. Um, so many, many things have happened. A woman, Henrietta Lacks, her cancer cells were used without her permission for experimental purposes. So there's a history of abuse and mistrust, and so it's really really important for um, our community to understand that this is something that will benefit everyone and get their fears and answers addressed.
Yes, and I appreciate you, sharing. We've had a number of conversations on YWTV with, various professionals like yourself that we've talked through, some of the historic issues that, have actually created, the concerns that are keeping people from getting the vaccine, especially Black people, African American people, people of color in, these communities, that there are real reasons that they fear coming forward that were placed upon them, um, by our society. So we do need to be helping address and support and helping them feel confident to be able to go forward for sure. So one of the things that is in your experience and your history of your work, I know, was teaching, and talking about sexual health um, with students across our state here. Can you speak a little bit about the importance of these conversations and having them? I mean, it's so I think that's when we think about Planned Parenthood, so many people think about the physical building and the health center itself, but the reality of it is so much of the work that you all do is out in the community and doing education,
Mhm,
partnerships, and collaborations with organizations and faith-based, entities and so forth to make sure that
mhm,
people have access to information and care. So I'd love to make sure that our viewers know about that work that you're doing and from your again experience why it's so important.
mhm. Personally, I taught human sexuality for about 18 years on a college level. And I was always uh, amazed at the number of students. On the first night of class, I would ask how many people have had formal uh, sexual education. These were college, not freshmen, but juniors and seniors. And most of them had not had any information, formal education regarding human sexuality. When I would ask a question about how many of them had had information provided to them from their parents, the response was about the same.
Mhm.
So we had young adults in a college environment, and I'm sure this is true across the country, who were figuring it out on their own, possibly using the internet, being misinformed, getting information from their peers who was just as uninformed as they were. And when it's so simple, when people have the information that they need to protect themselves and protect their partners, they have better outcomes. And it was very very exciting work to do to be exposed to young folks and their attitudes and issues around human sexuality. Regarding the organization, we're really proud of our education programs. We have a senior director of education as well as health educators, and they're able to go out into the community and provide health education, reproductive health education, not only to students in schools, but to professionals, to parents. We had a program where we actually had parents and children come in together. We called it our living room series, so that parents, who we often say should be the provider of sexual health information, often they're not prepared themselves to teach it to their children. So we're able to provide a forum so that parents can feel comfortable getting the information and education that they need. Their children are getting the information and education that they need. And then we combine the two groups so that they have the communication to speak with one another. We're really excited about that.
And I think it's so important, as you're sharing too, that that there's always age appropriate information that can be shared. Doesn't matter the age of your child. One
Yes.
ran past me behind me, as you may have seen. But that the age of the child, it's not an issue. It's the way that we share the information. But it is important to start these conversations young and have them regularly, because it definitely allows to be able to talk about all of these important issues,
Mhm.
and issues do come up.
And
That, yeah,
normalize it so that it's a natural conversation that you can have with one another.
agreed. Um, so what's ahead for Planned Parenthood New Jersey? Planned Parenthood I'm sorry, not New Jersey. Your Planned Parenthood Metropolitan. Um, you obviously have done all you can do to stay strong during this time, and not only have you done that, you've extended your work and added to it significantly.
Mhm.
What's ahead?
So we're in the second year of a 3-year strategic plan. As I said, we just rolled out our transgender services, and we're looking to expand that into other health centers. We've discovered that we really need to have a patient navigator, case manager type individual who is specifically working with this community to help some of the non-medical issues that come up. So we're actively seeking funding for that position. We are in conversations with the city of Jersey City so that we can provide some telehealth services to through their WIC program, Women's, Infants, and Children, and make sure that these women have access to the services that we can provide from a via telehealth. Um, and we're always just looking for ways that we can continue to expand capacity without necessarily opening other health centers right now.
Yep.
So we'll be hiring what we call a float team. We'll be expanding the hours that we're open and having the float team operate during those hours so that we can see more patients in the community.
Well, we are grateful, and we also, encourage our viewers to support this wonderful organization and the work that they're doing. Also, want to, make note. A few weeks ago, we had Roxanne on from the Thrive Coalition and talked about the Reproductive Freedom Act and the importance of getting that passed here in New Jersey. We've still not, since that conversation, we've still not, had the movement that we've wanted to see on that. So I do encourage everyone to um, continue to educate themselves on ways that they can support that piece of legislation. It is directly connected to the important work that Roslyn and her organization and our organization on what we all believe, it's important, for all of you to make sure that those that we put in office, that I remind everyone work for us, know that this is important to us, and we want to see it move forward.
Greatly appreciate that. Greatly appreciate that.
So with that, Roslyn, just want to thank you for taking the time to chat with us today. Again, I know how busy you are. You have not skipped a beat, during this, year plus crisis, that we have been in. And if anything, you and your team have met and surpassed, the work needed for sure. And it's so evident that you've got your team who's watching, and so many of your supporters that are cheering you on, and highlighting the amazing leadership that you have brought to this organization and the commitment to your work. And it clearly is a testament to your lifelong commitment and experience, that you bring. And I really appreciate and am inspired by the work that you do. So thank you.
And I thank you and congratulate you on your work with the YWCA. Planned Parenthood is certainly my heart, but the YWCA is close to my heart as well.
Yes.
So I thank you for the contributions that you're making in our communities as well.
Well, I love that you were part of our YW family, for sure. And as we all know, once you're part, we're all connected. So we're all still doing the work, linked arms for sure.
Yes, certainly.
So for those of you watching, I want to thank you for taking the time today. As you know, these conversations that we have are about amplifying the voices of our Black community, our Black women in our community. And I'd love for you to think about something you've heard today and share it in a conversation. I'd love for you to copy and share this broadcast with someone that you think would really benefit from it, or put it on your Facebook page so your network can see it. It's important for you to be part of this community process of sharing the mic. And it's that easy to do. We do have links in our comments so that you can connect with Roslyn's organization and follow the amazing work that they're doing. And as I always say, this work really happens because of the support of the community, whether it's your time or your money. We do encourage you to, consider supporting the important work. For us, we will be back with you again next week with a whole series of YW TVs and a Share the Mic Now. Tomorrow, for those of you who haven't signed up yet, we have two great programs we'd love for you to join us for. One is our Women's Empowerment Network program, Work-Life Balance. It's at 10 a.m. It's a virtual program. And also at 11:30 a.m., Improving Brain Balance and Memory for our seniors, and that's at 11:30 a.m. Also virtual and no charge for either of those. We are currently accepting applications for an Empower University, our Girls Leadership Academy, and I'm sitting outside, which is always an indication our camp time is here. So please consider the YWCA Northern New Jersey summer camp as an option to be able to give your children a great summer experience and give yourself some peace of mind that they are in good hands and having a safe, quality, and affordable summer experience. So with that, we wish everyone a great day. Roslyn, again, thank you so much for spending the time with me today. I've enjoyed talking with you, as I always do when I'm in your presence, and grateful for all you bring to our community.
Thank you again. Bye-bye.
Bye, everyone.